Ever wondered how doctors can be sure you really have asthma? Turns out it's way more complicated than you might think. Today's deep dive is all about a fascinating mystery in Canada surrounding one of the key tests for asthma.
Yeah. We're talking about the bronchial challenge test. You might know it as BCT. It's a bit of a hot topic in respiratory health right now.
And this all started because you sent over this research article, Patterns of Bronchial Challenge Testing in Canada, and I have to say, we were intrigued by what we read.
Oh, definitely a fascinating one. Published in the Canadian Journal of Respiratory Therapy, this study looked at how often doctors across Canada are using the BCT, and the findings were, how do I put this, kind of shocking.
Okay, hold on. Before we get to the so-called Great Canadian BCT divide, let's make sure everyone listening is on the same page. What is a bronchial challenge test? And why is it so important when we're talking about asthma?
So imagine this. Your airways, you know those tubes that carry air in and out of your lungs? Well, picture those like those small bendy straws you get with fancy cocktails.
Okay, I like where this is going. Our airways are the fancy bendy straws. Got it. What's next?
Well, for people with asthma, these airways, they're super sensitive, right? They can narrow and tighten really easily, and that makes breathing a real struggle. So what a BCT does is kind of mimic that reaction, but in a safe and controlled environment. We basically inhale this special mist that can, for a short time, cause a little bit of airway constriction.
So you're saying you're actually triggering a mini asthma attack on purpose?
That's the gist of it. And by doing that, we can measure how much your breathing changes. This tells us how reactive your airways are, which helps us figure out if someone truly has asthma, especially if their regular breathing test came back normal.
So it's like a detective tool for those tricky cases where a regular spirometry test doesn't give you a clear answer.
Exactly. And that's super important because overdiagnosing and underdiagnosing asthma both has some pretty serious consequences. You don't want to be putting anyone on medications they don't need. But on the other hand, missing an asthma diagnosis could mean someone ends up having a serious, potentially life-threatening asthma attack.
Makes sense. But, and here's the thing that really got us hooked. This Canadian study found that how often doctors use this test, well, it differs a lot depending on where you live. We're not talking small differences here. We're talking massive discrepancies in BCT rates across Canada.
Yeah, it is kind of strange when you think about it. You'd think a medical test, especially one this important, would be used pretty consistently across an entire country, right?
Right. It's not like we're comparing healthcare systems on different planets or something. It's Canada. Okay, so let me give you some numbers to illustrate just how crazy this is. Doctors in Quebec are ordering this test 4 times more than most other provinces. And then you've got Alberta. They're doing 8 times fewer tests. Like, what?
8 times. Wow. That is a huge difference. It really makes you wonder if your postcode in Canada could actually affect whether you get an asthma diagnosis. You know, that's something we definitely want to unpack today.
Absolutely. But luckily for us, the researchers didn't just leave us hanging with these crazy stats. They actually did some digging into why this Great Canadian BCT divide even exists. So, like any good detective story, we've got a lineup of suspects.
Let's crack this case wide open.
Suspect number 1. Could it be the number of, what do they call them, lung specialists? Respirologists in each province?
Well, it makes sense when you think about it. The more specialists you have in a specific area, the more likely those specialists are going to be using their, specialized tests.
Okay, yeah. It's like if I'm hanging out with a bunch of sommeliers, I'm probably going to be like seriously analyzing my wine, not just casually sipping it, right?
Exactly. You got it. And the study did find a connection there between the number of respirologists and the number of BCTs, at least in Eastern Canada. But and there's always a but, right? Western provinces like BC, Alberta, Saskatchewan, they didn't really fit that same pattern.
Oh, really? So they had fewer BCTs happening than their respirologist numbers would have predicted.
Yeah, exactly. So more lung specialists might explain part of this whole thing, but it's definitely not the whole picture.
Okay, so what else could be going on here? Could it be about how doctors are trained? Like maybe some medical schools are focusing on these BCTs more than others?
That's a really good question. And the researchers did actually look into that specifically, but they didn't find any kind of direct connection between certain medical schools and BCT rates. They did, however, bring up a pretty interesting theory, and it's this. Maybe, just maybe, it's got to do with the influence of certain big names in, Canadian asthma research.
Oh, interesting. Like some kind of great lung whisperer whose teachings were so influential that they kind of shaped how a whole generation of doctors approaches asthma diagnosis.
Yeah, you could say that. It seems like how some of the really prominent asthma experts in Eastern Canada were doing things, especially those involved in the early research, might still be influencing how doctors in those areas are diagnosing asthma today. Kind of cool when you think about it.
It is interesting. So you're saying medical knowledge is being passed down through these like almost invisible networks, kind of like a family recipe, but for, diagnosing asthma.
Huh. Yeah, in a way, I guess you could say that. And it really shows you how even within a country that has a national healthcare system, you can still get these regional differences just based on how things have always been done. But let's not forget about another factor that always seems to come up when we're talking about healthcare.
Oh, yeah, you're talking about the money, the financial incentives. Could it be that doctors are getting paid more to order these tests in some provinces?
I know it's the natural thing to assume, right?
Yeah.
But this study didn't actually find a strong connection between how BCTs are reimbursed and how often they're being used. There was, however, a pretty interesting exception, and, you guessed it, it was Quebec.
Quebec, of course. Our favorite BCT outlier. What's going on there?
So Quebec has this unique system where they compensate workers who develop what's called occupational asthma.
Okay, so that's asthma that's specifically caused by something in your workplace, right?
You got it. So if your job is making it hard to breathe, Quebec has your back.
It makes sense.
The catch is, though, to get that compensation, workers in Quebec, they need that objective medical proof. They need something like the result of a BCT.
Ah, okay. So are you thinking that doctors might be ordering more of these BCTs just to make sure that their patients have the documentation they need in case they need to file a claim for work-related asthma?
Bingo. It's a perfect example of how social and legal systems can really have a big impact on how medicine is practiced.
This is getting more and more interesting by the minute. So far, we've got regional practices, big-name researchers, workplace factors, and now we're throwing in some legal stuff. But there's another little twist to this whole thing. This research suggests that even though some provinces might be doing a lot of BCTs, Canada as a whole might actually be under-testing. How is that even possible?
Yeah, it's kind of the opposite of what you'd expect, isn't it? It all comes down to how many people should be getting a BCT based on their symptoms and all that versus how many people are actually getting one.
So even with Quebec going all in on BCTs, we're still missing a bunch of people who could really benefit from having the test done.
That's right. And it's important to remember, those BCTs are especially useful for the cases where a regular breathing test doesn't really show anything.
Right, like those cases where someone has asthma, but it doesn't show up on a spirometry. Tricky.
Exactly, which is why this whole under-testing thing is a pretty big deal. If someone's asthma isn't diagnosed, that means they could be missing out on treatment. And that can have some not-so-great consequences.
And like we talked about before, untreated asthma can lead to hospital visits, and in some really serious cases, it can even be fatal. So yeah, underdiagnosis is definitely something we don't want to be messing around with. Okay, so we've got all our evidence laid out, we've grilled our suspects and uncovered some pretty interesting stuff along the way. But let's bring it all back to our listeners. So what does this all mean for the person listening right now? Let's say you're listening to this in, I don't know, Manitoba, and you've had this cough that just won't quit. What do you do with this information?
Well, I think the biggest thing here is you really got to be your own advocate. It's about being informed, knowing that this testing, it's not the same everywhere. That's powerful.
I totally agree. You got to talk to your doctor. Don't be shy. If you've got those asthma-like symptoms, that cough that just won't quit, but your breathing test was fine, you can always say, "Hey, doc, I was listening to this podcast and they were talking about this thing called a bronchial challenge test. Could that be helpful for me?"
Yes, exactly. And it's not about like demanding a test, but having that open conversation. Tell your doctor your concerns, ask your questions, really understand why they're recommending what they're recommending.
And don't forget, second opinions, they're always a thing. What's normal for one doctor in one province even might not be the case somewhere else.
It's kind of wild when you think about it. Where you live, or even who you pick as your doctor, that could actually have an impact on how you're diagnosed and treated. It's not as straightforward as we might think.
Absolutely. It's not a one-size-fits-all kind of thing. And that's exactly why being informed and proactive is so crucial when it comes to your health.
This whole conversation, this whole deep dive, it's been fascinating, but it really makes you wonder, right, if we're seeing all this variation just within Canada and they have, national health care, imagine what it's like around the world.
I know, right? It really makes you think. Asthma diagnosis, it's a lot more complicated than it seems on the surface. So much to consider.
So to everyone listening, whether you're in Manitoba or anywhere else, keep those questions coming. Be your own best advocate, and never underestimate how powerful it can be to be informed when it comes to your health. Until next time, stay curious, everyone.